Hello, everyone. My name is Trishala Lockraj, and I am the Senior Director of Strategic Operations for Excelsior University College of Nursing and Health Science. Thank you for viewing this video and for participating in Excelsior's annual celebration of Nurses Week. In honor of this important week, and as part of Excelsior's continued partnership with the Capital District's Physician Health Plan Incorporated, CDPHP, we are excited to present a panel discussion titled Mental Health in Nursing, a Path to Better Outcomes. Additionally, Excelsior University is pleased to continue its partnership with CDPHP to support nursing education. A donation from CDPHP will help underwrite Excelsior nursing scholarships. It is my pleasure to introduce you all to our host, Robin Goodrich, the Larry Purnell Executive Dean for the College of Nursing and Health Science at Excelsior.
Thank you, Trishala. From May 6th to the 12th, Excelsior celebrates National Nurses Week, honoring the incredible impact nurses have had on our communities. Established by the American Nurses Association in 1990, National Nurses Week is a time to highlight the inspiring stories of our nation's nurses and express our heartfelt gratitude for their unwavering service and dedication. At Excelsior University, we are immensely proud of our nursing and health sciences students and alumni. Your commitment to excellence and compassionate care makes a difference every day. Thank you. Now, to get us started, I'd like to introduce our panelists. First, Lauren Grimshaw, Senior Vice President of Member Health Operations at CDPHP. Susan Hull, Practice Manager for Capital Care Developmental Pediatrics at Wellness Way. And Dr. Brian Purvis, Department Chair for the School of Nursing at Excelsior University. Now, I ask each of you to please share a bit about your background and why this topic is important to you. We'll start with Lauren.
Thank you so much, Robin. Thank you for having me today. My name is Lauren Grimshaw, as you said, and I'm the Senior Vice President of Member Health Operations at CDPHP. And I'm a licensed mental health counselor by trade. So I started my career in the healthcare field in direct practice with individuals living with mental illness and experiencing drug abuse. And so today I'm blessed to work in a different aspect of healthcare where I'm surrounded by nurses all day. I'm able to see just how talented they are, how smart and compassionate they can be, and what great advocates they really are for the patients that they take care of. And so mental health being a real strong passion area for me and understanding how it can impact both the personal and professional work that everyone is doing, but particularly nurses and other individuals in the healthcare field is really exciting. And I'm just so grateful for the opportunity to be able to contribute to today's important conversation.
Thank you, Lauren. And next up, Susan.
Good morning. Thanks for asking me to do this. I feel like I'm totally out of my league. So anyway, so I'm a nurse. I'm a baccalaureate program. I have a BSN, and I've always been a pediatric nurse. And as it turned out, I went from hospital nursing management to outpatient care management. And I've been the manager of developmental pediatrics for, a long time, since probably 1990. And what I've found through different employers in my practice is that you have to recognize your nursing staff, you have to support your nursing staff, and the job that I do as the practice manager, it helps tremendously that I have a nursing background because I'm able to sort of triage and make clinical decisions. So most of my answers today are going to be pretty simple and not well said probably, but I do appreciate the opportunity. And I just think it's a great overlap because May is Mental Health Awareness Month. And so for you to be talking to nurses as you're celebrating that career choice and supporting nurses in their career choice, that we're also thinking about how to keep nurses in the field and how to have us take care of ourselves. So that's all. Thanks for having me.
Thank you, Susan. We're very happy to have you on the panel. And next, Dr. Brian Purvis.
Hello, everyone. My name is Brian Purvis. I'm a doctoral prepared family nurse practitioner and a department chair at Excelsior University. I have focused on my career on mental health and other elements and components as it relates to mental health. I started my career as an LPN and worked my way up to an APRN. Mental health is important. It's a foundational piece to our work as educators, as clinicians. I've seen so many times how stress, how trauma, how silence around these issues contributes to the burnout, the attrition. So this topic is definitely a timely, important topic that we need to examine today. And I'm happy to be here today and to contribute to this webinar for you.
Thank you, Brian. And thank you to all of our panelists. This panel discussion, hosted by Excelsior's advancement team and the College of Nursing and Health Sciences, in collaboration with CDPHP, will explore the critical theme of mental health and its impact on nurses and patient outcomes. We have several questions regarding our topic. What is mental health and why is it important for a nurse? And what are the most significant mental health challenges faced by nurses today? And how do these impact patient care? Also, does someone have to get treatment or help to address their mental health? What are the benefits of receiving help? And what happens if someone does not want to receive help? Perhaps our panelists can share some strategies, treatments, or programs that have been implemented to support the mental well-being of nurses in healthcare settings. And then also, concerns about new nurses leaving the bedside or leaving nursing altogether. How can academics and nursing practice professionals partner to support nurses' mental health and help keep them in nursing? So let's get going. So we'll start with Lauren. What is mental health? Why is it important? And what are the significant mental health challenges faced by nurses today?
Thanks, Robin. So when we talk about mental health, we're really talking about all of the things that impact our emotional, psychological, and social well-being. Mental health is about the way that you're thinking about things from a cognitive perspective, the beliefs underlying that. It's also the way that you might interpret things that are happening around you and then begin to react or respond to them. And so thinking through all of the different layers and aspects of mental health makes you sort of stop and think about how it is just as important as any other aspect of your life to make sure that you're tuned into your mental health. You're paying attention to the way that you're thinking, feeling, acting, and taking steps to recognize when things might be off. So as you mentioned, I think in today's panel, we're going to talk a lot about what good mental health looks like, maybe what warning signs that mental health needs to be prioritized more could look like, and then also how to access treatment and really begin to take care of a person's mental health. In the nursing field, I would say that taking care of your individual mental health is important because you want to be able to bring your best self to work every day. And in the nursing field, when you're taking care of patients, if you're not taking care of yourself first, then there are a lot of potential issues that could come from that. Things like patient safety, quality of care, even down to communication and ability to handle stress or navigate through day-to-day challenges that come up. So your mental health is kind of like the foundation for being able to do all of those things well.
Thanks, Lauren. And we'll turn it over to Susan. Susan, what is mental health? Why is it important? And what are the most significant mental health challenges faced by nurses today? And how do these impact patients?
I have to say, I had to look up the definition of mental health so that I would really have a clear understanding of what the definition was, not just what my thought was about what the definition was. So I'm very appreciative to Lauren, who actually knows this stuff herself. I mean, I feel like, and it's interesting because I'm taking this from the perspective of the staff and the nursing staff, the professional staff that are caring. There's tons of caregivers for patients, but also for the mental health of the patients, because that interaction that you're having with the patient is flavored by where they're coming from and what their experiences have been. And I think a lot of times we may react to somebody, and it's good to step back and recognize that sometimes people are acting a certain way because they're anxious or they're scared. I mean, especially if you're talking about a caregiving setting, like an acute care setting, a hospital, something like that. I do think it's very important to know and understand yourself and recognize what your strengths and limitations are, and to always work yourself. I mean, I was thinking about it driving to work. I think I'm on my 5th therapist now. In fact, my therapist just told me one died, all the rest, I just moved on. But my therapist told me recently that I'm 64 years old, that my demographic is one of the smallest demographics for seeking and getting mental health care. And I just feel like, not that everybody has to go to therapy, don't get me wrong, but it's one of the tools that you can use. I know I'm getting ahead in the questions, but it's one of the tools that you can use so that you can sustain a long-term career in what is a very draining profession. So anyway, you've got to get me back on track. What's the next question that I was supposed to answer?
So in your opinion, what are the most significant mental health challenges faced by nurses, and how do these impact patients?
I feel like in general, the nurses has to do with having too much responsibility for the manpower that you have for the services you're providing. And so that affects mental health in the sense that you probably always feel as though you're never quite getting everything done you need to have done. I've been and I still have a dream that I cannot get down to room 37. And a whole shift went by and I never assessed the child, never even laid eyes on the child in that room. It's a long time since I've done that. And yet I think that's just so imprinted, because you kind of go in every day and you don't know what you're going to be faced with. Staffing is a problem. And if you're somebody who's a perfectionist, you have to recognize where you can cut corners. So, I mean, I think probably that's not really necessarily a mental health issue. It's just that your mental health suffers when you feel like you're not adequate enough on a regular basis.
Yeah, I would agree, Susan. I mean, certainly as nurses and healthcare providers, we hold ourselves to a very high standard, and when we feel that we're not making that mark, it does cause some distress for sure with the practitioner. Dr. Purvis, what is mental health? Why is it important? And what are the most significant mental health challenges faced by nurses, and how do these impact patient care?
Yeah, great question here. So to Lauren's point, I agree. Mental health is definitely emotional. It's going to have a physiological component. It's going to be our social well-being. We have to understand that mental health is important. It's going to be important for our decision making, right? Our empathy as nurses, our communication, right? Our resilience. On a student level, right? And a clinician level, it's going to impact our students' learning outcomes. It's going to impact our quality of care. We know that a mentally healthy nurse is going to be safer and more effective. So mental health is definitely an important topic that we should be discussing today. Now, when we look at the challenges that we see faced by nurses today and how do they impact care, well, there's a lot of different challenges. Well, let's think about burnout, right? Nurses are going to get burned out. Students are going to get burned out. There's moral distress because of conflict, right? Compassion fatigue, right? A lot of trauma that we see as nurses. On the student level, right? Our students are facing performance pressures, clinical stress, right? They're going through issues in their life and role strain as they're trying to become nurses. And a lot of these things can lead to high patient errors or decreased, empathy towards patients and family members. Even what we're going to talk about here, early exits from the field, right? Nurses are leaving the field, right? Because of mental health issues. We know, again, this is challenging because it's going to affect our patient safety, our teamwork, like Lauren said, communication, and our quality and continuity of care.
Thank you, Brian. Okay, let's jump to our next question, which is around getting treatment or help. So, does someone have to get treatment or help to address their mental health? What are the benefits of receiving help? And what happens if someone doesn't want to receive help? I'll ask the panelists to share any strategies, treatments, or programs that have been implemented to support mental well-being in nurses in healthcare settings. And we'll go to Lauren.
Thanks, Robin. There's so much to unpack there, and I think it's a really great set of questions. So your first question, do patients have, or do people in general have to get treatment in order to get help for their mental health? Honestly, the answer is no. I think it's a common misconception. You don't have to enroll in formal treatment in order to take care of your mental health and be attentive to your well-being. There are many regular things that you can do at home or with a friend to prioritize your own mental health. And so first I'll talk a little bit about some of those things, and then I can talk a little bit as well about formal treatment options. So everyday things like self-care practices, and what that looks like for one person might look a little bit different for the next person. But really what self-care is about is just doing things for you as an individual that prioritize your own well-being, whether it's regular exercise, healthy eating, getting adequate sleep, or practicing mindfulness and meditation. So those self-care practices can actually be life-changing for a person who's looking to really center down on their mental health and be a little bit more in the moment. When we're thinking about mental health and well-being, I remember hearing this story about how being depressed is kind of like holding on to things from the past that might be troubling you today, but they've already happened, whereas anxiety is being worried about the things that are going to happen in the future. And what's absent when you're letting those sorts of feelings and thought come in is that opportunity to really just be grounded in the moment. So self-care practices could really help a person do that. And having a strong social support network, whether that's your friends, your family, your coworkers, if you're in an educational program, your trusted advisors, people in your social support system can really make all the difference. And having just one trusted individual that a person can talk to openly about their stresses, their challenges, the way that they're feeling can really make all the difference. But sometimes people really do need to access formal treatment. Sometimes those self-care practices and those kind of lifestyle changes that we make at home are just not enough. And so it's really, really important to, one, have the self-awareness that you might need more than that. And two, have those trusted people in your life that can kind of act as a sounding board or a mirror maybe for you to say, like, yeah, I think it's time that we maybe look into some formal treatment options to help you get back on track. And there are a lot of really good treatment options out there. They're validated, they're evidence-based, and they work. Some are free. So if the person is an employee, lots of companies have employee assistance programs, or EAP. You might have heard of that. It's usually short-term counseling. It's free, offered through your employer. And it's a good way for people to sort of dip their toes into the field of receiving mental health treatment, because it's usually pretty short term and you don't necessarily have to commit to very much at all. You can kind of like test it out. And then there is formal talk therapy. There are a variety of different methods that can be used in talk therapy. If medication is recommended, a person may choose to see a psychiatrist who can prescribe medications to help them manage whatever symptoms they might be experiencing. And then again, kind of beyond just your typical support network in your own life, there are many options out there that offer formal support groups, which is really the idea of other people who might be experiencing similar thoughts or symptoms or challenges coming together, either facilitated by a peer with lived experience or a professional, to bring like folks together to talk through those challenges as a group. And the benefits of that can really be remarkable when you realize that you're not alone in what you're going through.
Thank you, Lauren. I appreciate your perspective in this space. You are certainly a wealth of knowledge here, as this is one of your many areas of expertise. I appreciate it very much. I was jotting down a few notes for myself. Turn it over to Susan. Susan, this question again is about, does someone have to get treatment or help? The benefits of receiving help, and sharing strategies, treatments, or programs that have been implemented to support the mental well-being of nurses.
Well, thank goodness Lauren's here and Dr. Purvis, because I don't have as well structured answers. I don't think, I mean, my big feeling about things is you cannot, even parents can't make their children do things or not do things. And so if you ask the question, does someone have to get mental health treatment? No, they don't. It's unfortunate in a lot of areas where people don't, because it makes such a positive difference for the individual and also for the people in the individual's lives. So, I mean, I certainly recommend it. Ready on Landers for a lot of years. And, you know, if you're not going to be able to get therapy with someone, at least get it for yourself. I also believe pretty strongly in simple tools, you know, like Lauren was saying. I mean, there are things that I just say in my head, you know, there's not much that a good night's sleep wouldn't help. And if you're really struggling, just go to bed early, you know, just end that day that you're having. And just all kinds of different things. Try, feel, adjust. If this isn't working, change it. See what kind of an outcome you get. And mostly it has to do with practical approaches. I don't want to be cheesy in using the airplane analogy, but, you know, with putting the oxygen mask on first, you're going to help the people in your lives to sustain their life too. And so the measures that Lauren talked about, whether it's counseling, whether it's through the employee assistance program as a jumpstart or then on to something more formal. And again, changing that if that's not working. If people have issues, there's a lot of people that have issues with addiction and with, you know, just saying the serenity prayer. You don't have to necessarily say it to a God of your understanding. You can just say it and basically turn it over and get some help for yourself, because we might feel as though, you know, we have superpowers as a nurse, but it's very difficult to sustain that level of expectation of yourself. So getting help, whatever the means are, is very important.
Thank you, Susan. Thank you. Thank you, Susan. And Brian.
Yeah, so what I'm going to say here, you know, does someone have to get help or treatment to help address or deal with their mental health? Just like my colleague said, no. We can start informally, especially with things like reflection, right? Look inward, peer connection, connect with your peers, healthy boundaries. We know formal treatment is going to have a benefit, it's going to be beneficial, but it's not always the first step, right? There's other things that we can do. We must normalize, though, seeking support, because we need to encourage people to seek support at any stage so that it's not stigmatized. In education and in clinical practice, we need to look at things like small changes, right? Because that's going to matter. Check-ins, right? Flexible deadlines for students, even in the workplace. And then when we look at the benefits side, right? The benefits of receiving that mental health help, well, we're going to see, right? They're going to cope better. Right? You're going to have increased clarity, right? You're not going to be so distressed or burnt out. In the academia world, you're going to have improved academic performance and clinical performance. And it's also going to create an important ripple effect. When others see you seeking help, they're also going to seek help. They're also going to feel better. And then when we look at, you know, different strategies, right? What strategies can we implement to support mental well-being for nurses in healthcare settings? Well, you look at this two ways. In academia, well, we can say wellness check-ins, right? What about counselors, embedded counselors? What about mentally health informed syllabi, right? You know, making sure we focus on mental health in our syllabus across our program. In our clinical setting, well, cold lavender, right? Mental health, right? Peer debriefing, employee assistance programs, like Lauren said. You know, we need to make sure mental health is visible, right? Accessible, and that is culturally safe for everyone across the board.
Thanks, Brian. I really like what you said about healthy boundaries. And I think that as caregivers across all of our healthcare disciplines, that is a challenge. Just being able to say no or not right now, or having our limits is, I think, an area that we can explore, certainly, as educators and leaders, to help our new practitioners coming up and those that are in practice already. So we have really one final theme, and that is around nurses leaving the bedside, and we can expand that into healthcare providers in general. We do have an issue in nursing where we educate new nurses. They get out into practice, they realize what they are up against, and they either leave the bedside and look for something that's not a direct client care type of role, or leave nursing altogether. So this question is really around how can we as academicians and our practice partners support nursing and healthcare provider mental health and keep our nurses in nursing, keep our healthcare providers taking care of patients and clients and communities. Where do you see some of the opportunities, and what can we do together to make that happen? And I'll turn that over to Lauren.
Thanks, Robin. I think really it's just about creating a culture of acceptance where recognizing that addressing your mental health is not a weakness, it is actually a strength. Accepting that individuals are going to have different needs as time goes, right? And so people who are very high performers, very focused, very dedicated, may have bad days, and that is not a problem. But it's continually having bad days and not doing anything about that, like Brian said, not asking for help, and fostering a culture where it's difficult to ask for help, I think only makes the problem worse. And so really, as leaders in both the academic world and in the direct practice world, I think creating an environment where people can do their best work without any sort of fear, that if in a way to do their best work, they have to set stronger boundaries, they have to take small breaks and step away, have to maybe take a day off to practice mindfulness and self-care, or go to a therapy session and just prioritize their own well-being, that is actually something that folks are encouraged to do. And I know it's not always easy, because today everyone in healthcare is basically being asked to figure out how to do more with less. But that's really dangerous in this field. And so I think as a collective, we need to try to do a better job at just recognizing when workplaces are becoming toxic and not allowing that, doing something to change the narrative and encourage a better balance, encourage better staffing ratios, encourage folks to take the time to prioritize themselves so that they can give their best to their patients.
Thank you, Lauren. And Susan, do you have concerns about new nurses leaving the bedside, leaving nursing, and how can academics and practice support each other and support nurses' mental health to keep them in nursing?
Well, I feel like not turning on ourselves, each other, will make a big difference, and I guess I feel like asking for help is not what it's like in hospital now. And I mean, I had to leave bedside nursing because I was burnt out on it. I had a vacation and I had nightmares every night of that vacation. And my former husband said, "You need to find a new job." And I ended up doing that because I never felt as though I could get done. And this is a long time ago. Nursing is entirely different now than it used to be, in terms of especially technology. I think to myself often now, I would be such a better bedside nurse now, knowing what I know, having the experience I have in life and professionally, to be able to sustain that type of job. And the nice thing for your students, I think, if they are people who are living life and, trying to balance work-life challenges, this is good because they have some maturity and they have some insight and they have some experience that they can bring into the field. And I think it's important, if possible, to find a mentor. I mean, if they had an orientation system where it wasn't just somebody trained you on the unit, but then that was your mentor, and that person you could go to and seek assistance from and suggestions. And usually it's going to be somebody that has more experience than you do, and they can give you tips on how to manage things. For me personally, the things that I handle now, I handle patient complaints, excuse me, in my role. And I never pick up the phone to talk to somebody that I don't say a quick prayer to myself that I say the right words. I did it before we did this today. It might be that before you walk into a bedside, particularly if you're going to be encountering something that's challenging, like let's say you've got somebody with bad burns and you're about to go in and do a burn dressing change. Just whatever you need to do for self-calming, for if it's box breathing, anything, if you know those techniques that you can use, that's what you should do. And you can employ them quietly. It doesn't have to be structured, but it has to be second nature for yourself. So I think that it's important. Self-care is important. And whether that's eating right or exercising or any of those other things, what's going to keep nurses in nursing, and especially at the bedside, is if they have good self-care skills. It's knowing when to take a meal break. It's taking a meal break. It's not, and the nurses that were successful that I saw were the nurses that knew how to do those things. And I do think it's really important in a helping field that we help each other. And if you see that somebody is struggling, that you don't look down upon them because they can't manage it, but provide them with the support to help them manage it, because you're going to have your day too. And just have to be a team. And I think if you've got a group of nurses working together on a unit that feel like they're a team, then that's going to help in the long run to keep the team intact. All basic stuff.
Great insights, Susan. I completely agree. I think as, nurses, we need to move into that culture shift, right? Where we're supporting each other versus, looking upon, areas that folks need support as a weakness, when really we need to be supporting each other and lifting each other up. And it's okay to ask for help and take a breather or whatever. So thank you for that. And Brian, I'll turn it over to you. Concerns about nurses leaving the bedside. How can academics and our practice partners support nurses' mental health and keep them at the bedside, keep them in nursing?
Yeah, thank you for that. So yes, there is some concerns about new nurses leaving the bedsides and nurses in general. There was a study that was released when I came into this that I read that it was by Shaw back in 2021, and it examined the prevalence of nurses who are experiencing burnout. And what we see is over 40% considered leaving the field, right, identified burnout as a reason. 60% of those nurses, right, close to 2/3 of those nurses cited, right, mental health as a contributing factor, right, that mental strain, those mental issues are playing a factor that's driving nurses leaving the bedside. So to Susan's point, she's right, and I agree with her that we need to create mentoring programs, right? Nurse residency, but past nurse residency, onboarding supports. We need mental health programming, right? Education. We also need to strengthen, right? Like our academic to practice bridge, right? We need to bridge that gap, making sure like students are emotionally prepared and that they're ready for practice when they graduate. We also need to make sure that we have a consistent support system in place that's going to support our students when they go from school to that practice environment. We know that, if you retain students, you retain nurses, right? It's going to build relationships. We also need to normalize our vulnerability here, and we need to make sure we're sustaining wellness beyond graduation into practice. So there's many elements to this. And again, I think we can fix this problem.
Thank you, Brian. Well, I just want to say a sincere thank you to all of our panelists, Lauren, Susan, Brian, and also Trishala, who for coming together today and having a great conversation around this very, very important topic. So thank you again to our panelists, and thank you to our nurses everywhere. Happy Nurses Week.